Coronavirus came to the world's attention in late December last year. The World Health Organization was quickly on the case, reacting through its social media accounts, but it took months before WHO announced a pandemic.
And we're deeply concerned both by the alarming levels of spread and severity and by the alarming levels of inaction. We have therefore made the assessment that COVID-19 can be characterized as a pandemic.
The World Health Organization began monitoring coronavirus in early January, and on the 11th of March, after the declaration of the pandemic, it was the only news story being told.
You can say within the UN system, the WHO is the only specialized agency that focuses on global public health. It's actually even one of the oldest agencies. It's been around now for more than 70 years, and it really does a lot of things. It advocates for universal healthcare, monitor public health risks, set standards and guidelines. That's a quite important function. And also coordinate all the work around emergency, around infectious disease, chronic disease. It is a place to go within the UN system for many, many countries.
But now doubts have surfaced about WHO's relevance. Its decision-making has been questioned, and its public statements made about China rebuffed.
Today I'm instructing my administration to halt funding of the World Health Organization while a review is conducted to assess the World Health Organization's role in severely mismanaging and covering up the spread of the coronavirus.
The United States contributed 15% of the WHO's 2018-2019 budget at more than $400 million. Cutting these funds would be damaging but not disastrous, and other nations have already made it clear that they will make up any shortfall.
Cutting the US funding to WHO, that is a huge impact. The US is the biggest contributor to WHO. Look at the immunization campaign, right? WHO has been battling, for instance, against polio for a very long time, leading surveillance, immunization, technical support. Lack of funding will probably impact, I think, that battle, including also other immunization campaigns like measles, for instance. But it's also an issue of the US. I mean, WHO is critical in looking at early warning, right, when it comes to pandemic. So less money will actually turn against even those countries who may want to rely on WHO capability when it comes to pandemic preparedness, for instance.
As the US reduces its presence in the WHO, China's grows. At the 73rd World Health Assembly, China's President Xi Jinping pledged $2 billion for the fight against COVID-19.
When you look into low-income countries or even some middle-income countries, the WHO is doing a quite vital work of expanding healthcare, whether this is maternal health services or vaccination programs or propping up the healthcare system. These are all critical functions, especially when it comes to technical assistance that WHO actually fundamental to these countries.
The proxy war between the US and China will harm the WHO's credibility to such an extent it could be the ultimate casualty of the coronavirus pandemic.
Right now it looks as if WHO is only doing COVID-19 and nothing else. In fact, the World Health Organization takes care of nearly all the diseases that are possible in the world, from communicable diseases, meaning those who can be transmitted easily by whatever means, be it malaria, tuberculosis, HIV, and anything like it, measles very typically, but also many of the non-communicable diseases, so those who don't normally get transmitted, cancers, diabetes, autism, hearing problems. So literally from A to Z, all possible health issues do get dealt with by WHO. We have over 150 country offices in the world where people deal directly with the ministries of health in these 150 country offices to deal with any public health problem that may arise and to provide the assistance necessary for the countries to work with them. withholding or withdrawing about 20% of the budget, which the US, for example, is right now giving, is certainly a big issue for any organization. So this would have definitely a large impact. It would have an impact on all sorts of programs, not only COVID-19, but also on polio and on malaria, on TB, whatever you want to name, and would definitely have an impact. At the same time, it was very, very important to see last week at the World Health Assembly the outpouring support by nearly all member states. We need all 194 member states to fight together against any disease, but more so now against this coronavirus or against COVID-19 as there is. So it's of course difficult to speculate what the future of the funding would be, and we have to take it step by step, literally. But for the COVID-19 response, I'm fairly positive because members have been really outpouring with support, and there's a lot of international attention on it. Yet this is an organization which is dealing with public health. Politics should not be part of it. The Director General said a while ago, this virus will kind of show us the weaknesses in our societies. It will show us the gaps in our systems, and let's just hope that these gaps will not be in the funding towards a very vital and necessary COVID-19 response.